Assalamualaikum, ma'am. I hope you're doing good today. Thank you for taking your time for us. I welcome you on the behalf of Team Pro-Choice Pakistan on today's session. Today we are going to talk about female reproductive health. And before we start, for my audience, I want to introduce our speaker. Today we have with us Dr. Anam Rafique, who has graduated from Rawalpindi Medical College, and she spent a spring semester in USA in Wyoming University, and today, as of now, she's working in Rawalpindi Benazir Bhutto Hospital. So let's start with today's session. Ma'am, I want you to answer a few questions because हमारा session जो है वो थोड़ा सा interactive and Q&A section है. So आप हमारी audience के लिए kindly कुछ चीज़ों को बिल्कुल basic से explain करें. For example, what is menstrual cycle? इसका pain कैसा होता है? Fertility levels क्या हैं? इस तरह की जो basics हैं.
So basically, premenstrual syndrome is an amalgam of both. It has both physical symptoms and emotional symptoms.
Right, like mood swings.
Mood swings. So women have emotional symptoms in a way that they have mood swings, they have rage, anxiety, and they feel like they're depressed, and they have low mood, and they have food cravings. I have food cravings all the time when I'm PMSing. So apart from that, physical symptoms like the woman can have headaches, migraines, body aches, abdominal pain, cramps, stuff like that. So these are the days before the period begins. So for some women, these symptoms last the whole cycle, like for 21 days or for 25 days, they experience these symptoms and they mistake these symptoms for PMS. Ladies, if you experience these symptoms all month long, it's not PMS, it's something else. So it's better to get consult from a gynecologist ASAP, because if you're having low mood all the time and you're referring it to your menstrual cycle and your hormonal levels, no, that's not true. So you need to see a psychiatrist or somebody who can actually, guide you towards doing better for your mental health.
Right on this. कि एक बहुत कह रहे हैं कि डिसमिस्ड किस्म का टॉपिक है जिसको लोग इतना ज्यादा बात नहीं करते, वो ये है कि मतलब आपका पीरियड जो है वो कितने डेज रहना चाहिए. बड़ी एक अंडरस्टैंडेबल चीज है. लोग कहते हैं कि हाँ मतलब ये नॉर्मल सी बात है कि 28 से 35 डेज, बट इज इट ओके फॉर अ वुमन टू हैव समथिंग बिफोर 27 डेज और आफ्टर 35 डेज? मतलब साइकिल में कितने चेंजेस जो है वो नॉर्मल चेंजेस हैं?
Okay, so it comes down to regular and irregular cycles. So it's better to keep a calendar to keep record of dates of your period. So like I said, normal cycle is 21 days, but it can vary anywhere between normal cycle is 28 days, I'm sorry, right. But it can vary anywhere between 21 to 25 days. So if you're having your period after every 21 days, like the period is day 1 of the cycle. So you're having it after 21 days, like regularly, the cycles are regular, then that's not an issue. But if the cycles are irregular, like once you have it after 35, then next you have it after 15, like stuff like that. If the cycles are irregular, I think that is when you need to be concerned, because irregular cycles and irregular menstrual bleed, there are a lot of underlying pathological factors which can lead to the irregularity of cycles. And this, I'd like to discuss it here, that in regard to this question, that HMB, heavy menstrual bleed, is such a common symptom that women present with these days. And कुछ औरतों को idea ही नहीं होता that heavy menstrual bleed, they consider it to be a normal flow, and it's actually not a normal flow. They're just losing a lot of blood, and they lose so much blood to the point that it causes anemia. So when their blood tests are done and their hemoglobin comes out to be 6/7, and then when the history is asked from the patient, they complain that yes, they have been bleeding heavily. So do you understand? Like women, they are not prepared at all. Even not I'm not talking about women who belong to underprivileged backgrounds or women who do not have access to internet or education or stuff. Even educated women who have access to internet and all resources, they don't understand what is the normal flow and how and what do they need to do if they understand that they're not losing normal amount of blood. So initially in the beginning of the cycle, obviously you bleed heavily. So 80 ml, well, how should I? So 2 completely soaked pads in a day is normal. ये आम ज़बान में मैं इससे ज़्यादा क्लैरिटी
ये बेहतर है क्योंकि लोग जो है वो वाकई mls को तो नहीं इस तरह से समझते, but they do understand.
If you're using more than that, or if you need to change your pad every 2-3 hours, I think that's abnormal, and you need to see a doctor as soon as possible. That's heavy menstrual bleed. Right. So again, there are multiple causes of heavy menstrual bleed, and we prescribe medications like we give clonazepam. And again, I'm not prescribing any medicines here, because even if I take the name of a medication, people will just experience those symptoms and they will start buying those medicines. I do not want that. Never take a medicine without a proper prescription.
Right.
So initially the bleeding is in the first 2 days you bleed a lot, and then gradually it slows down. So that is how it works.
मैं एक बात जानना चाहूंगी कि मतलब अब आपकी बात से ये चीज़ मुझे अंदाज़ा हो रहा है कि ठीक है, कुछ लोगों को, ख़वातीन को स्पेशली, ये चीज़ पूरा मंथ फील हो सकती है, बट जो एंजाइटी और मूड स्विंग्स हैं वो तो फिर भी मुझे लगता है कि वो पार्ट है जो कि ऑब्वियसली आई एम नॉट सेइंग कि ये माइल्ड पार्ट है, बट स्टिल फिजिकल पेन जो कि बहुत इंटेंस किस्म की फिजिकल पेन होती है. I have examples in my family, and I've seen people going through a lot of pain, and to a point where they can't bear it, and they have to take either painkillers or do some other remedy to lower that pain level. So, what would you suggest for those people? Obviously, it's concerning because कुछ लोग dismiss भी कर देते हैं. So, I just want you to highlight that part.
But it's so important to understand that if the pain is unbearable to the point that you cannot carry out your routine activities, you cannot get out of bed, you cannot show up at work, and even taking normal painkillers is not helping. So that is where you need to, I cannot stress it enough, need to see a doctor for that, because this is not normal. The reason you feel that pain, it can either be primary dysmenorrhea or secondary dysmenorrhea. Primary dysmenorrhea is normal, like there is no underlying pathology, and you take a normal painkiller, you take Panadol or Ponston or Brufen, and you're fine. But if you're suffering from secondary dysmenorrhea, there can be multitude of causes which can lead to that. And one of the major causes of severe pain during your period is endometriosis.
Right,
So yeah,
right.
period pains, severe period pains are not normal.
कि जो आपने पेन लेवल्स की मैंने पहले बात की थी, और आई गेस थोड़ा सा पार्टली टॉपिक एड्रेस भी हो गया, लेकिन एक चीज जो मुझे लगता है कि जब पेन लेवल्स को डिसमिस करने की बात आती है तो ख़वातीन सिर्फ इसलिए डिसमिस नहीं करती थी क्योंकि उन्हें लगता है कि वो मेलोड्रामेटिक है, बल्कि इसमें बहुत बड़ा एक रोल जो है वो सोसाइटी का, जैसे आपने कहा था कि हाँ मतलब ये तो नॉर्मल है, सब गुजरते हैं इस चीज से. तो अगर सोसाइटी कर रही है वो चले एक चीज है, लेकिन अगर डॉक्टर्स डिसमिस करते हैं आपके पेन को, या डॉक्टर्स भी समटाइम्स कह देते हैं कि नहीं ये तो नॉर्मल है, ये दवा खा लें ठीक हो जाएगा, और इसके बावजूद भी ठीक नहीं होता, और पॉसिबली कोई अंडरलाइंग कॉज डिफरेंट हो सकती है उस चीज की, तो उस सूरत में ख़वातीन को क्या करना चाहिए? मतलब व्हाट शुड दे नो बिफोर गोइंग टू अ डॉक्टर अगर उनको सिवियर पेन?
I hate how cruel that is. Doctors do that. I have seen doctors doing that firsthand, and it's so unfair. I mean, women present to us with this complaint that they have severe pain during their menses, and we just tell them to take constant for it. It's not. I mean, well, okay. So what can be done? I think the woman herself should be very vocal about it. When she's seeing a doctor, a gynecologist, she should be very expressive in telling that this pain has been excruciating for her. And I think if she tells symptoms associated with the pain, like if she tells that she's not able to get out of bed, she's missing tasks, she is unable to show up at work, if she tells stuff other than pain, which add to it, I think the doctor will be able to understand that it's not normal pain. Like being a doctor myself, if somebody tells me that she is unable to show up at her job, I will have an instant click in my mind that, okay, if the pain is so bad, there must be an underlying cause to it. So I'll get an ultrasound ASAP, or I'll ask other questions in the history related to the factors that I will need to exclude in order to make a diagnosis that what is actually causing such a severe pain.
राइट. सो मैं आपका ओपिनियन इस चीज़ पे भी देना चाहूँगी कि जो मेडिकल गैसलाइटिंग है, या कह लें कि मिस डायग्नोसिस के बाद आप पेशेंट को डिसमिस कर देते हैं, या इस तरह की और बहुत सारी चीज़ें हो सकती हैं. मतलब ये तो मैंने दो वैसे बातें की हैं कि ये दो केसेस नॉर्मली देखने में आते हैं. सो क्या किया जाना चाहिए ख़वातीन की तरफ से? मतलब थोड़ा सा पार्शली ये चीज़ क्वेश्चन पहले एड्रेस हो चुका है, लेकिन मेडिकल गैसलाइटिंग पे लोगों को कॉल आउट किया गया. सो इस इशू को किस तरह से एड्रेस किया जा सकता है? पाकिस्तान में ये बहुत है.
I think it's like, well, the doctors community should be educated. I don't know. But the thing is that obstetrics, gynae, ये वो field है that the patient load everywhere is immense. Well, in private setups, obviously it's not that huge. But हमारी गरीब आवाम, हमारी majority आवाम, जो कि एक तो हमारे होते हैं ना, देखिए अब पाकिस्तान में हर किस्म के लोग हैं. एक तो elite and they can afford private medicine, they can afford private medical care. They show up to their gynecologist and they are treated like they want to be treated. Even their histories are properly listened to. But most of our people are seeing doctors in government setups. और हमारे पास, you probably would not believe me, but every day we see like 500 patients in gynae OPD.
Oh.
जब इतने ज़्यादा patients are on the heads of like 2 doctors, it's so hard to triage them at that very instant कि अच्छा इसका ये genuine मसला है, so we have to ask more and more questions. Most of the time we're so occupied with like a huge patient load that if somebody tells us they have pain, dysmenorrhea, pain during menses, all we do is like write the medicine and just tell them to follow up later if the pain does not subside. And it's not the ideal thing to do at all. I don't endorse it, but because you said that medicine doctors are actually doing it, so this is partially one of the reasons that doctors do it. Secondly, how we can combat this? Well, I think doctors के लिए भी awareness sessions होने चाहिए, where the general public, the word of general women, especially the women who cannot afford private medical care, their questions and their queries and their concerns should be brought into notice of gynecologists and obstetricians. They should be told that this is what the general public faces. So, they should be more considerate and, more patient towards listening to the complaints of patients.
Right. So, हमें थोड़ा सा गाइड करें इस बात पे कि ये जो फैट शेमिंग होती है ख़वातीन की particularly especially in the years when they are considered to be fertile. So उस टाइम में कुछ ख़वातीन वेट गेन कर लेती हैं. ख़वातीन तो नहीं कहना चाहिए, मतलब उस एज में ऑब्वियसली वो लड़कियां ही होती हैं, तो वेट गेनिंग होती है और बॉडी में डिफरेंट किस्म के चेंजेस भी आते हैं. तो एक तो फैट शेमिंग के इशू पे थोड़ी सी बात की जाए, और दूसरी चीज ये कि इस फैट का या फैट गेनिंग का बॉडी के वेट का पर्टिकुलरली क्या लेना देना है किसी भी दूसरी हेल्थ कंडीशन से, लाइक फॉर एग्जांपल PCOS या sorry, I'm not taking it right.
Totally all right.
Okay.
It's totally normal. Endometriosis, but the terms are
Yes.
too hard. Even we cannot pronounce them sometimes, so it's totally all right.
Yes. So can you please throw light on this?
Yeah, I mean, yes, again, you have amazing list of questions. And these are all the questions that need to be addressed. I'm proud of the team who has been jotting all these. Well, okay, so PCOS, yes, it's related to weight gain, but doctors who just say that weight loss is the only effective treatment. Again, it's so wrong. It's so wrong. Weight loss is not the only effective treatment to PCOS. It's one of the treatments. I'll tell you why. Again, we are going to talk in detail about PCOS and all other disorders. So I'll talk in detail about how weight is related to PCOS in that section. But right now, all I can say is that obesity itself leads to a lot of other problems. Like it can lead to heart issues, diabetes, hypertension stuff. So I think exercising and doing stuff that helps you reduce weight is important. But that being said, fat shaming, it should not be done at all, especially by doctors. It's so wrong. And doctors who are doing that, I mean, this is the practice that should not be normalized. And I hate to say this again, but I have seen doctors doing it. No,
Right.
I mean, I think for some part, it's not even in the, it's not even in the hands of the concerned patient who has gained weight. So, yeah.
मैं इस बात पे आपको मतलब आई वांट टू पॉज एंड से थैंक यू, बिकॉज आपने एक बहुत इंपॉर्टेंट चीज हाईलाइट की है कि ये जो वेट गेन जो है या PCOS जो है, इस टाइप की बीमारियां सिर्फ वेट पे इफेक्ट नहीं डाल रही होती, इनका दूसरे हेल्थ इशू से भी लेना देना होता है. फॉर एग्जांपल आपने बात की हार्ट डिजीज की या ब्लड प्रेशर के ऊपर नीचे होने की और इस तरह के इश्यूज. सो हमारे यहाँ ये चीज नहीं अंडरस्टैंड की जाती कि आपकी फर्टिलिटी के अलावा भी बॉडी में बहुत सारी चीजें होती हैं जो कॉज ऑफ कंसर्न बन सकती हैं, और फर्टिलिटी पर्टिकुलरली फॉर फीमेल बॉडी जो सोसाइटी का मोस्ट इंपॉर्टेंट या मोस्ट सिग्निफिकेंट कंसर्न है वो फीमेल बॉडी की फर्टिलिटी है, नॉट फीमेल बॉडी की स्ट्रेंथ या उसकी इंड्योरेंस या उसके बाकी वीकनेसेस या इलनेसेस या कोई और प्रॉब्लम. तो थैंक यू फॉर हाईलाइटिंग दिस इशू. ओके, इसके साथ मूव करते हैं हम लोग अपने नेक्स्ट क्वेश्चन की तरफ. नॉर्मली हम सिम्टम्स को उस तरह से अंडरस्टैंड नहीं करते. हम जब आपकी बॉडी ऑन पीरियड होती है तो बहुत सारी चीज़ों को हम वैसे ही डिस्कार्ड कर देते हैं कि ओके ये तो नॉर्मल है, तो ऐसा तो होता रहता है. सो आप मुझे जरा सिम्टम्स बताएं डिफरेंट बीमारियों के जो कि खवातीन को ड्यूरिंग द मेंस्ट्रुअल साइकिल या बिफोर और आफ्टर दैट साइकिल वो अंडरस्टैंड कर सकते हैं, क्योंकि नॉट एवरीवन कैन अफोर्ड टू गो टू अ डॉक्टर ऑन एनीथिंग और एनी इनकन्वीनियंस. और मोस्टली जो हमारी लेडीज हैं, एक मुझे लगता है पाकिस्तान में जनरल ट्रेंड है भी टू अवॉइड डॉक्टर्स और टू अवॉइड टू going to hospitals. So can you please explain them? Kuch normal symptoms.
Yes. Okay, so yes, women generally consider everything that's happening to their bodies, everything that's happening to them during their, am I audible?
Yes, you are.
So women generally consider everything that's happening to them normal when that's not the case actually. So if they suffer from excruciating pain, like we talked about earlier, then they should make sure that they bring it into notice of a doctor. And other than that, if they have heavy menstrual bleed, then once again, they have to make sure that they consult their gynecologist. So what happens is that now how different diseases are, like how different symptoms that they experience, so what are the different symptoms that they experience, which, they should be concerned about. So PCOS, it's very common these days. Very, very common. Like almost 1 in 10 women have PCOS. So in PCOS, what happens is, and it's generally more common in women in their younger ages. So in PCOS, what happens is that women have irregular menstrual cycles. Like they have oligomenorrhea or amenorrhea. Oligomenorrhea is basically, irregular menstrual bleed. And other than that, in addition to that, women have other hyperandrogenic symptoms. So by hyperandrogenic, I mean like hirsutism, which is basically excessive facial hair growth and weight gain. and what else? And acne. So if a young girl is experiencing hair growth or weight gain or acne, and then her cycles are irregular, it's like is a 90% good chance that she has PCOS. So that is when she needs to see a doctor. Get an ultrasound done. And if on ultrasound, because polycystic, as the name indicates itself, there are multiple cysts in the ovary. So we get an ultrasound done, and if the ultrasound indicates multiple cysts in the ovary, then that is when the definitive diagnosis is made. So these are the alarming symptoms to diagnose yourself with PCOS. Coming to endometriosis, endometriosis as compared to PCOS is more common in women in their in elder women, and most commonly women who present to us with endometriosis have this complaint that they have excruciating pain. Excruciating menstrual pain is the major alarming symptom for endometriosis. And also one thing that women usually complain about is that they are unable to conceive despite trying for years. So they are probably concerned that they're infertile or something. So that is when the basic investigations are done, ultrasound is done, and the woman gets to know that she is not infertile, instead she has endometriosis. So if you have irregular cycles, if you have excruciating pain, if you have androgenic symptoms, that is when I think you should be concerned to see a doctor as that. So for PCOS, the first thing that we ask the patient to do is lifestyle modification. Like I said, that patients usually present with a weight gain, so cut down on high sugar diet and have a balanced diet. Like the balanced diet basically means that the patient should have appropriate proportion of protein, carbohydrate, fiber, fruits, vegetables. Lifestyle modification has a huge role to play in both PCOS and endometriosis. And after lifestyle modification, we these two, they are the oral contraceptive pills, and we also suggest progesterone. Well,
ओके अनम काइंडली आप हमारी ऑडियंस को ये बता सकती हैं कि जो प्रॉब्लम्स नॉर्मली खवातीन को फेस करनी पड़ती हैं इस तरह के इश्यूज में, फर्टिलिटी रिलेटेड इश्यूज में, या पर्टिकुलरली पीसीओएस, एंडो या एडिनो, इनमें क्या लाइफस्टाइल चेंजेस लाए जा सकते हैं ताकि हमारी बॉडी जो है वो उस तरह से एडजस्ट कर सके जिसके बेहतर तरीके से हम अपने आप को इक्विप कर सकें? लाइफस्टाइल चेंजेस, फूड चेंजेस, और कौन सी ऐसी चीजें हैं जो पर्टिकुलरली अवॉइड करनी चाहिए, या कौन सी ऐसी चीजें हैं जो डाइट में इनकॉर्पोरेट करनी चाहिए ताकि इन प्रॉब्लम्स को अगर बहुत ज्यादा ना सही लेकिन कुछ हद तक कंट्रोल किया जा सके?
Yeah. So lifestyle modifications have a huge role to play in combating these disorders. And women who present to us with PCOS, endometriosis, or other such issues, the first thing that we tell them to do is to improve their lifestyle. And by improving the lifestyle, I do not at all mean कि कोई fancy वो जो है वो ketone diet खाना शुरू कर दें, not at all. So PCOS may, because like I said, weight gain is one of the major symptoms that is seen, and most women present with weight gain. So we initially advise the woman to lose weight. So we tell her to exercise as much as we can. So we usually are advising like 20 minutes a day or like half an hour a day as per her ease. And other than that, we advise women to get proper balanced diet. And by proper balanced diet, I mean that the women should be cutting down on excessive sugar intake and excessive like oily foods and chili food and stuff like that. So we recommend that women eat balanced diet. And by balanced diet, I mean that their diet should have equal proportion of fiber, fruits, seasonal fruits, like aajkal aam aaye hue hain. So we recommend women to have fruits of the season and fresh vegetables, green vegetables, and the right proportion of carbs and fat. So like taking a whole diet. They should not be just, overdosing themselves on rice, or like fiber and fiber. Taking, I think, the right balance of different foods really helps them do better, like nutritiously. Secondly, lifestyle modification may, after exercise, we exercise, diet, and sleep routine. That's very important. And stress. Well, I cannot stress it enough. Okay, healthy. ठीक है, आप अच्छा खा लें, आप अपनी नींद पूरी करें, sleeping for like 6 to 8 hours, because like it said that sleeping for 9 hours, I think, weakens the immune system. So get your proper sleep and get your proper food and take care of your mental health. We sometimes think that our mental health has nothing to do with our physical health, but our mental health has a lot to do with us, with our whole personalities, I think. So अपने आप को stress से और tension से दूर रखें, and just take care of yourself, whether it's your regular PMS, whether it's your PCOS, whether it's your endometriosis. So yeah. Like initially, mind pain के लिए take Panadol, take boiled egg. There's no harm in that. लेकिन पेन इज एक्सेसिव और आप लाइक NSAIDs भी ले रहे हैं, फॉर एग्जांपल इफ यू आर टेकिंग ibuprofen or something, और उससे भी आपको आराम नहीं आ रहा, तो गेट एन अल्ट्रासाउंड डन और समथिंग.
राइट. एक और चीज जो मेरी ऑब्जर्वेशन में रही है, एंड आई सर्टेनली होप कि बहुत सी जो खवातीन या यंग गर्ल्स जो मेंस्ट्रुएशन को फेस कर रही होती हैं, बहुत टाइम्स डॉक्टर्स जो हैं वो बर्थ कंट्रोल पिल्स उनको सजेस्ट करते हैं, या कुछ ऐसी टाइप के पिल्स जिनके कंसर्न्स जो हैं वो फर्टिलिटी पे भी हो सकते हैं, या लॉन्ग टर्म हेल्थ कंसर्न्स उनके होती हैं. फॉर एग्जांपल एक पिल है, मुझे, अब मैं खुद उसको नहीं लेती रही, लेकिन मेरी कुछ सर्कल में लोग हैं जानने वाले जो इस पिल को लेते रहे हैं, तो दे डू हैव माइल्ड इश्यूज विद दिस पर्टिकुलर पिल. और इस तरह की और भी बहुत सारी हैं जो आपको ओवर द काउंटर मिल जाती हैं, समटाइम्स प्रिस्क्रिप्शन पे मिलती हैं. तो इन पिल्स को, जो कि बर्थ कंट्रोल और बाकी चीज़ों के लिए भी यूज होती हैं, क्या इनके कोई लॉन्ग लास्टिंग इफेक्ट्स हैं बॉडी के ऊपर, या फर्टिलिटी रेट पे किसी किस्म का कोई नेगेटिव इम्पैक्ट डालते हैं? तो अगर डालते हैं तो, या जो भी इनकी इश्यूज हैं, इनके अंडरलाइंग इश्यूज, आप उनको थोड़ा सा हाईलाइट कर सकते हैं और ऑडियंस को हमारी को गाइड करें कि अगर कुछ इस तरह का होता है तो कितनी अमाउंट में उनको लेना चाहिए. ऑब्वियसली अदर देन डॉक्टर ने जो प्रिस्क्राइब किया, समटाइम्स लोग सेल्फ मेडिकेशन की तरफ भी चले जाते हैं. काइंडली हाईलाइट दैट.
Okay, so before I highlight this, before I get into the depth of this question, which needs to be addressed, so important, I cannot like it's so important to understand कि pharmacies पे usually बैठे हुए होते हैं quacks, ठीक है?
Right.
Or you go to them, you tell them your symptoms in a line or two, हमें ये मसला है, and they give you the medication. Don't trust them at all. Please see a gynecologist. Please see a doctor of that field before you start taking birth control pills, before you start taking contraceptives. तो ये होता है कि endometriosis में we give contraceptive pills. They are basically because endometriosis में the pain is cyclical. So contraceptive basically क्या होता है? It's hormone, right? So when the pain is cyclical, when you're having that excruciating pain with your monthly cycles, if you stop the cycles, the pain will not be there, right? So initially, to alleviate the symptoms, to stop the cyclical pain, we give contraceptives. Or PCOS may be because the cycles are irregular, so we prescribe contraceptive pills ताकि हम लोग hormones देते हैं, and through those artificial hormones, the cycles are regulated. But
Right.
these are not those pills that can be taken by yourselves from any pharmacy over the counter. Please don't do that to yourself. Please see a doctor.
सही. और इनके जो साइड इफेक्ट्स होते हैं, अगर किसी को साइड इफेक्ट्स हो रहे हैं, चाहे उन्होंने डॉक्टर की प्रिस्क्रिप्शन पे ली है या चाहे खुद ली है, तो क्या क्या करना चाहिए उसके बाद कि इमीडिएटली उसको उस इफेक्ट को कम किया जा सके?
So usually in my practice, I have not seen people complaining of a lot of side effects. In fact, their symptoms are alleviated और उनके cycles भी regular हो जाते हैं. But if you, because again, it varies from person to person too, it's very subjective. Some women do face symptoms, side effects of these medications. Some people do present with diarrhea or like severe body disturbances after that. So if we're facing side effects which are not normal, once again, I would say कि consult your doctor. Maybe you're not taking the right dosage, or you're like, not taking it on proper timings. That is why you are facing those side effects. So
Right.
Maybe an alternative can be suggested by the doctor in place of those pills which are causing all of that. तो ये नहीं है कि बिल्कुल fertility होगी नहीं, but ये है कि once the disease is treated in time by taking the right measures, obviously the woman can conceive. But if not, it can just be bad. बाकी PCOS में ovulation induction we give, like we prescribe medication, we give clomiphene and stuff. Well, I would not get into the pharmaceutical terms of the meds that we prescribe for ovulation induction, but treatments हैं. So it's not ये बात नहीं है कि बिल्कुल भी like infertile हो जाएगी औरत, ऐसा नहीं होता. And even in endometriosis, so basically endometriosis में होता ये है कि जो like the name indicates itself, कि endometrial lining जो होती है ना, the lining of the uterus, which is supposed to be inside the uterus, it's implanted in abnormal sites. Like that is basically either in the fallopian tubes. If I had a paper or pen with me, I could have like drawn. So होता ये है कि uterus होती है, पीछे fallopian tube, and then we have the ovaries. That is how the female reproductive system works. So the endometrial lining, instead of being inside the uterus, is implanted either in the fallopian tubes or in the ovaries. So एक term है chocolate cyst. I think some people might have heard of it. So उसमें ये होता है कि basically endometrial lining is in the ovary. So what happens is that during the normal cycles, when the endometrium is supposed to shed off, जो normal cyclical हमारा process चलता है. So, and when it's supposed to like bleed, and when that layer has to go through the vagina to the outside world, what happens is that it bleeds inside the body. Like if that lining is present inside the tube or inside the ovary, it's going to bleed there, right?
Yes, it will not pass.
Yeah, so just imagine, like if there is blood inside the pelvis, if there is blood inside the tubes or the ovary, how is a normal embryo even going to get, like, where is it going to get planted, or how is it going to thrive or survive in the normal reproductive pelvis, like the normal pelvis of the reproductive woman? So ये है कि endometriosis really affects the reproductive system. So the earlier you get it treated, the better it is for the woman who is planning to conceive later in life. So
So
yeah. So in endo, I was telling okay, if the pain is excruciating and it's not being alleviated by any painkiller, then we do prescribe hormones. We do prescribe contraceptives. So because the pain is cyclical, so once the cycle is stopped, the pain is stopped. And other than that, if we talk about surgery, because obviously, like I explained endometriosis in detail earlier, how the endometriotic tissue is in abnormal sites in the body, it might be in the ovaries or in the tubes and stuff like that. So in order to combat that, some laparoscopic procedure is done in order to get that endometriotic tissue outside the body. So yeah, surgery is a mainstay of treatment, and especially for women who want to conceive. So for women who who are in their reproductive years and who want to conceive as early as possible, laparoscopic treatment is the choice for them. I hope audience will understand what laparoscopic is. Laparoscopic means that we do not cut open the body. We instead use an instrument. It's a laparoscope which is inserted inside the body through the vagina. So it's a very it's a very sensitive and a good procedure, because when you are cutting the pelvis open, obviously it has a lot of cons associated to it. So in order to overcome in order to
minimize those effects.
In order to minimize those effects that come with cutting the body open, I think laparoscopic procedures are the mainstay of treatment these days. और अच्छे सेटअप्स में laparoscopically ये चीज़ें होती हैं, लेकिन obviously हमारे गरीब अस्पतालों में जहाँ पे हमारी आवाम usually show up करती है, फिर we don't have the resources, but तो फिर we do cut the pelvises open too, but well, क्या किया जा सकता है उसके बारे में. And if you talk about adenomyosis, and mostly women जो कि adeno के साथ present करती हैं, I did not explain what adenomyosis is. It's basically endometriosis, but the endometrial tissue, instead of being in any abnormal path, like instead of being inside the ovary or the fallopian tube, the endometrial tissue is basically in the myometrial lining of the uterus. It's basically uterus. Allah ne matlab itni qudrat hai, mashallah, ke we have different layers. So there's the innermost lining, then there is a muscle layer of the uterus. So when the endometrial tissue is implanted in the uterus, that is when we call it adenomyosis. So women who basically present with adenomyosis are usually older women, and they usually have their families completed. So if their families are complete and they present with such symptoms, and because adenomyosis, once again, the symptoms include pain, and a lot of pain. Pain is not as bad as the pain of endometriosis, but iska bhi kafi pain hota hai. And more than pain, because obviously आप खुद सोचो कि uterus की muscle layer में एक extra tissue पड़ा हुआ है. So before the normal period, obviously we have cramps. Cramps are when the uterus muscle contracts. So when the uterus, and in adenomyosis, the uterus gets boggy because of all that tissue inside the muscle layer.
Oh,
so
yes.
when the uterus contracts, the woman just faces severe cramps. So it gets bad. And also in adenomyosis, the woman presents with heavy menstrual bleed. So if the woman's family is complete and if she does not have anything to do with fertility, hysterectomy is the last resort. Hysterectomy is basically the removal of the uterus from the body
itself, right? So मुझे एक चीज और पूछनी थी कि normally ऐसा होता है कि आपकी बॉडी में कहीं और ऐसे सिम्टम्स शो होना शुरू हो जाते हैं जो कि आपको किसी भी गायनी रिलेटेड प्रॉब्लम के साथ एसोसिएटेड होते हैं. वो फॉर एग्जांपल थायराइड, बहुत से लोग खवातीन पर्टिकुलरली थायराइड को सिर्फ थायराइड के तौर पे देखती हैं, लेकिन थायराइड प्रॉब्लम्स आपको तब भी होते हैं जब आपको कोई अंडरलाइंग मेंस्ट्रुअल इशू हो या कोई और गायनी का इस तरह का इशू हो. सो शुड पीपल बी कंसर्न्ड इफ दे आर हैविंग दीज इश्यूज आउट ऑफ नोवेयर, और समटाइम्स ऐसा भी होता है कि फैमिली हिस्ट्री होती है. सो व्हेन इट इज गुड टू कंसर्न अ डॉक्टर ऑन दिस.
Again, it's so important to understand that thyroid may, once again, you need to consult a doctor for that, because अब क्या होता है कि thyroid के मसले usually the surgeons deal with that. Gynae के मसले, obviously gynecologist, and we have obstetricians, we have gynecologists for that. Obstetricians deal with obstetrics, that's different. So for thyroid, if you feel like your symptoms are associated with that, if you're hyperthyroid or stuff, so it's always advisable to get your TFTs done. TFTs are basically thyroid function tests. They include T3, T4, and TSH. They are the hormones which are produced by the pituitary and the thyroid gland itself. So by getting those levels, we can see whether the patient is hyper or hypothyroid, or whether the menstrual irregularities or other menstrual issues were related to the thyroid itself, or were they distinguished from them, and the woman was just overthinking okay, maybe they were related, or but it's advisable to get TFTs done.
Right. Thank you, doctor. I can say bottom line ये है इस सारी बात की कि 80% fertility related issues हो सकते हैं और 20% times नहीं हो सकते. Am I right?
Yes, definitely.
Okay. So अब आप मतलब अगर हम इसी चीज को थोड़ा सा आगे बढ़ाते हैं, एक ये जो चीज होती है कि नॉर्मली लेट डायग्नोसिस होता है, उसका क्या इफेक्ट हो सकता है आपकी बॉडी पे, फीमेल बॉडी पे, पर्टिकुलरली इन देयर रिप्रोडक्टिव ईयर्स. और दूसरी चीज ये कि मतलब जो क्योंकि अब हमारे पास डिजिटल एज है और हर चीज़ एक क्लिक अवे है, बहुत से लोग करते हैं कि इन्फॉर्म रहने के लिए वो अपने सिम्टम्स को गूगल करते हैं या जानने की कोशिश करते हैं कि उनके बॉडी के साथ जो प्रॉब्लम्स चल रहे हैं वो क्या है, क्योंकि समटाइम्स सिमिलर केसेस आपको मिल जाते हैं. सो डॉक्टर्स डोंट लाइक इट.
Women who present to us after whole workup of their diagnosis कि हमने गूगल किया था, हमें ये बीमारी है, ये मसला है और आप हमें ये दवाई दें. I hate those patients. I'm sorry, yeah, you should be like concerned. Concern is legitimate. आपको पता होना चाहिए कि आपके साथ क्या हो रहा है. You should know your proper history. But googling your symptoms and making a diagnosis and coming to a doctor and telling them the diagnosis is bullshit. Don't do that, please. So yeah, be very self-aware of your symptoms. Be very aware कि ये चीजें हो सकती हैं. Googling, most of the times Wikipedia, I don't think we can trust Wikipedia anymore. I don't know. Google आपको एक time पर there are multiple sites that you can that you have easy access to. You just type in the words and Google shows you multiple sites, and not every and any site can be trusted. So ये है कि do educate yourselves while you can, but once you see a doctor, to listen to the doctor too, because the doctor has a medical degree and the doctor is going to give you the information that is legitimate, not just random Wikipedia knowledge.
But ये इशू प्रॉब्लम्स जो है ये पर्टिकुलरली उन लोगों के साथ होता है क्योंकि जब आपकी मेडिकल हिस्ट्री नहीं सुनी जाती या जब आपके साथ बहुत डिसमिसिव सा बिहेवियर चल रहा होता है, तो ऑब्वियसली वो लास्ट रिजॉर्ट जो है रह जाती है खवातीन के पास इसी टाइप की. क्योंकि सैड फैक्ट इज कि बहुत सारी हमारी जो ओल्डर जनरेशन की खवातीन हैं उनके टाइम्स पे, आई डोंट नो क्योंकि आई एम नॉट फ्रॉम दैट जनरेशन, आई एम सॉरी, बट उनके टाइम्स पे शायद वो प्रॉब्लम्स नहीं थे या शायद उनको उतनी अवेयरनेस नहीं थी या जो भी रीजन थी. अब की जो खवातीन हैं या जो शायद डाइट में चेंजेस आए हैं या जो भी चेंजेस आए, आई डोंट नो, क्योंकि ऑब्वियसली आई कैन नॉट मेक अ कंपैरिजन विद द पास्ट क्योंकि आई हैव नॉट बीन देयर. बट अगर उस जनरेशन में ये चीज नहीं हो रही थी और इतनी अवेयरनेस भी नहीं थी और ये जो मेंस्ट्रुअल इश्यूज हैं इनको सोचा इस तरह से जाता था कि ये तो शादी के बाद होने वाले इश्यूज हैं, ये यंग लड़कियों को कहाँ से हो गए. लेकिन अभी हम देख रहे हैं कि स्टैटिस्टिक्स और ओवरऑल वैसे भी कि लड़कियों में ये प्रॉब्लम्स आ रहे हैं. तो वही बात है कि इफ दे कैन नॉट टेक हेल्प फ्रॉम देयर मदर, इफ डॉक्टर्स आर डिसमिसिंग देम, सो लास्ट रिजॉर्ट ऑब्वियसली गूगल रह जाता है. सो कैन यू से समथिंग टू इनकरेज दैट काइंड ऑफ सेल्फ अवेयरनेस कैंपेन जो खवातीन में आजकल जनरेट हो गई है. और ऑब्वियसली यू सेड कि यू हेट पेशेंट्स जो कि इस तरह करते हैं. ऑब्वियसली आई एम नॉट सेइंग कि डायग्नोसिस भी पेशेंट्स को खुद ही कर लेना चाहिए, बट इजंट इट बेटर टू बी अवेयर and then go to a doctor so that you get ensured that you're not being gaslighted or you're not being dismissed just on the basis of having so many patients by doctors. So अगर आप उस लाइन में नहीं लगना चाहते, आप काइंडली इस चीज पे थोड़ा सा बताएं कि क्या सेफ लिमिट है टू गूगल और क्या कौन सी लाइन है जो कि पेशेंट्स को या जिन लोगों को डायग्नोसिस चाहिए उन्हें क्रॉस नहीं करना चाहिए.
Yeah, so before coming to a very a whole answer to whatever you asked, I'm sorry, hate is a very, very strong word. I apologize if I used it. Did I use it? I'm sorry. I don't hate my patients. No, I mean, I might dislike them for doing this, but I don't hate them. Patients, no doctors should hate patients. If we start hating patients, I think we do not have any, authority to be in this noble profession. So I'm sorry. I apologize. No hatred for anybody. And well, that being said, you said कि पुराने माशरे में औरतों के इतने मसाइल नहीं थे, अब मसले. ऐसा बिल्कुल भी नहीं है. यही जो बीमारियां हैं पहले भी थी. Maybe not in the same proportion as they are today, but even in the age जो कि हमारी अब दादियां हैं या नानियां हैं या जो हमारी जो हैं मदर्स हैं, उनके टाइम पे भी इश्यूज होते थे. बट लाइवा, आई थिंक in that time most of their issues in their young age were not taken on board, most of them, because awareness नहीं थी, इतना social media नहीं था, इतना if you're getting my point, इतना
yes of course Google नहीं था उस वक्त, उनको बहुत सी चीजें नहीं पता थी.
Yeah, so because they did not have such open access to internet and such open access to these resources, most times even if they faced those symptoms, they did not know that these symptoms are not normal. So, and they probably, if they even had like heavy menstrual bleed, or even if they had like pain during their cycles or irregular cycles, they would have like taken it normal. कोई कभी उन्होंने जॉट डाउन नहीं किया होगा कैलेंडर पे कि ये दिस वाज द टाइम और दिस इज हाउ माय साइकिल वाज सपोज्ड टू लुक लाइक एंड द साइकिल इज एबनॉर्मल इन दिस मंथ. तो मसले उनको होते होंगे उस टाइम पे भी, बट दे डिड नॉट हैव द राइट outlets to openly discuss. और ये टाबू समझा, अभी भी टाबू समझा जाता है for some
बिल्कुल बिल्कुल
part. I'm glad we're doing it today, but you know कि जी period word क्यों बोला है? Oh अस्तगफिरुल्लाह, हाय क्या हो गया?
एग्जैक्टली.
I
फैमिलीज
don't
में तो
know, it's just
पर्टिकुलरली
so
ये बहुत
bad.
बड़ा इशू है कि आप अपने
Yeah,
मेल रिलेटिव्स के सामने, चाहे वो आपके कितनी क्लोज रिलेटिव्स हों, आप नहीं बोल सकते. ये एक सैड रियलिटी है ऑफ पाकिस्तानी सोसाइटी, इन द नेम ऑफ वैल्यूज और इन द नेम ऑफ आई डोंट नो व्हाट कल्चर दे आर ट्राइंग टू प्रिजर्व, बट दे डू दिस. और फिर उसमें
it's
साइलेंट
not what
सफरिंग जो है
culture.
खवातीन.
Yeah.
And so, what test would you recommend for those people before getting married who are planning to have a family or who are planning to get married? Because mostly people in Pakistan, for a vast majority, people get married to start a family. So, what would be your recommendations, especially to the couples, to ensure their sexual capability and to ensure that they produce healthy children and they do not face problems themselves during that period of time when they are expecting a child?
Yeah, okay. So once again, this has to be the most important question of today. And I'm glad we're talking about it because women, I have seen cases jahan pe people get married to their like first cousins and people get married in their families or unko andaza nahi hota कि they are putting lives at stake. They get babies with thalassemia majors and their babies die and they just say कि Allah की जान थी, Allah ने ले ली. No, it was partly their fault. They brought the life into this world. They should have,
Right.
you know, taken precautions at the right time. So the thing is that if you're marrying your families or if you're marrying your first cousins, before you get married, get a blood group. People never get blood grouping done because they think कि blood group से क्या होना है. But blood grouping is important. I'll tell you why. Because, for example, if a woman has a negative blood group, like Rh negative, and if the father has Rh positive, तो इसमें फिर RH incompatibility वाला एक factor आ जाता है. So after it's again a wide topic and I will not get into the details कि क्या होता है RH incompatibility और उसमें कैसे erythroblastosis vitalis develop हो जाता है and stuff. You don't need to get into that. But सिर्फ ये पता कर लें कि if the husband and wife both have different like negatives and positive blood group, so इसमें ये है कि in first pregnancy the woman has to have an injection to save later babies from any kind of complications. तो वो anti D हम लोग immunoglobulins लगवाते हैं. So blood grouping is important to make sure that both of them have positives or one has negative, one has positive.
Right.
After blood grouping, thalassemia. अच्छा, thalassemia is so common and जब मैं thalassemia के बच्चों को देखती हूँ लाइबा, because like I said, I work in a government setup and हमारी when I was in pediatrics, I remember I used to see a lot of babies who presented to us, और thalassemia के patients, from the look of them, मुझे तो इतना आपको तरस आता है और I felt like crying multiple times उनको देख करके. This is what their parents did to them. And when you take their history, they tell you that they're married in their families, they never got any genetic testing done, nothing before their marriage, and then they tell you proudly कि पहले भी ऐसे हो चुका है, पहले बच्चे मर चुके हैं और family में.
Oh,
मतलब you see something is happening and you don't control it. I think either ठीक है if you are not, because people who present with kids like that, they usually are not educated and they're from such backgrounds जहाँ पे इतनी awareness नहीं होती. But I think इधर बात education की भी नहीं आती, इधर बात अपनी I would keep myself from using this word, पर ये तो सीधी सी जाहलियत है कि आप मतलब जब आपकी फैमिली में आपने फर्स्ट हैंड देखा है कि ये पहले हो चुका है and still we're putting so many lives at risk. तो बच्चे आ रहे होते हैं, वो खून लगवा रहे होते हैं because thalassemia major में the patients need blood transfusions
blood transfusion.
on and on.
Yes.
And so how do you know that your babies are going to be thalassemic or not? उसमें ये होता है कि there's this test called hemoglobin electrophoresis. The name is quite fancy, but it's a simple test. उसमें देखते हैं the levels of hemoglobin A, hemoglobin A2 in the body. तो इसमें ये होता है कि if the father and the mother both are thalassemia minors, there is a high chance that their baby will be thalassemia major. So if you get your hemoglobin electrophoresis done and both the parents, like both the husband and wife, are minors, they should not get. It's not ideal for them to get married at all. Their baby is going to be major. But if one is minor, the other one is normal, they can get married. If both are majors, again, no way. If both are minors, no way. Because when you are thalassemia minor yourself, you do not your life is not at risk. You survive. But when you make a baby who is major, the baby is at huge risk and the baby is not going to make it. So I think
Right.
hemoglobin electrophoresis is very important before your marriage. Other than that, I
Right.
think once again, it's not talked about much, but hepatitis testing is important. I suppose hepatitis B, hepatitis C testing, because these are, well, uh, these are those diseases that get transmitted through sexual contact. So if one of the two partners has it, the other is going to get it. So I think hepatitis screening is important before putting yourself into this contract of marriage.
Right.
So yeah. And
Thank you
also
so
in
much,
certain
Anna.
families, the autosomal recessive disease tend to transfer. So yeah, before you get married, just make sure that you have the definitive those streamlined tests done.
Right, right. So are these tests easily available in Pakistan?
Yeah, so these tests are available. They are easily available in all private labs. They are costly. Like hemoglobin electrophoresis costs you. I do not know the exact price. I'll have to check, but it's not a not a cheap test. बाकी government setups में ये government hospitals में I think they're cheaper. You can get these tests done, but you have to pay a much less price as compared to getting them done from any private lab.
Right. So
So free of
obviously, I
cost.
guess
So
making your
I
child suffer through so much pain, because I believe that blood transfusion is not an easy job for the child who's getting it. So अपने बच्चे को उस प्रॉब्लम में डालने से पहले अगर थोड़ा सा आप पैसा या थोड़ी सी एनर्जी और टाइम इन्वेस्ट कर दें इस टेस्टिंग को करने के लिए, तो आई गेस दैट विल बी अ फार बेटर ऑप्शन देन पुटिंग अ चाइल्ड थ्रू दैट मिजरी. सो
yeah yes.
ओके. Thank you very much, Dr. Anam Rafique. I am really glad that we have had you today. So, at the end of the session, आपका मैं एक तो पूरे प्रो चॉइस की तरफ से शुक्रिया अदा करना चाहूँगी. दूसरी बात ये है कि मैं चाहती हूँ कि अगर आपके पास कुछ और है ऐड करने के लिए, क्योंकि obviously we are not the experts, mashallah you are, so it will be really kind of you to add anything that I might have missed.
Okay, so first of all, I am thankful to you guys for having me here and for giving me a platform to talk about such important issues. Because when I myself was working in gynae department and every day I saw patients suffering from these all these conditions that we just talked about in the podcast, I always used to think कि यार कुछ ऐसा होना चाहिए कि मैं खड़े होकर सबको बताऊं कि यार अक्ल करो औरतों, अगर ये मसले होते हैं तो show up. And one thing I would like to mention here is that women, I think they need to value themselves more. Women need to understand that they are amazing creatures. They're beautiful, and the way they are built by God is perfect. ठीक है? Suffering from PMS is normal. If you're having low mood for 2, 3 days a month, it's normal. Don't go hard on yourself. कि ये ना सब क्या हो रहा है. Suffering while you have your PMS and you have body aches and you have pain and stuff. Just don't, be like कि मैं क्यों नहीं बाकी वो भी तो मतलब just don't compare yourself with the rest of the women who are on the other high days of their cycle. So respect yourselves, respect your cycles, and whenever you feel like things are getting out of control, whenever you feel like your body is not coping up with everything, and you feel like you need to see a doctor, please don't be hesitant. हम लोग आपके लिए हैं. Please show up. And women, पता है, the best part about I am not like I'm not that kind of. I am a feminist. I'm a hardcore feminist, but I am not that feminist who says कि जी, men should be, you know, uh, they should disappear from planet Earth. No, I don't believe in that either. But ये है कि obstetrics gynae में usually we have women. Like it's a very female dominant profession, and most doctors that patients see when they show up in gynae department, most of the doctors are women. So I think a woman is, it's easier for her to open in front of a woman. So when a patient walks into the OPD of a hospital and she sees a woman sitting there, she's more, comfortable in sharing her personal history and stuff. So please, or but before the thing is that before even showing up at the hospital, the woman has to, take up a whole fight. Women should like trust their instincts, trust their bodies, and whenever they feel like they need to see a doctor as soon as possible. See a gynecologist, or when you are seeing a gynecologist, be very vocal, be very confident in expressing how you feel. So so you're able to just a second, just a second.
Right.
Yeah, so see a doctor and get your treatment done, or be very expressive in telling how you feel like.
So thank you so very much, Anam. I'm really glad that we had you today. मैं आपको बता नहीं सकती कि मैं कितनी खुश हूँ इस सेशन के बाद, because मुझे लगता है कि बहुत सारी मेरे माइंड के मिथ्स, और आई होप हमारी रिस्पेक्टिव ऑडियंस की भी बहुत सारी क्वेश्चंस उनके ऐसे, या उनके थॉट्स जो उनको पहले शायद क्लियर नहीं थे, या उनके लिए एक पाथवे नहीं था. आई होप ये बहुत सारे क्वेश्चन उनको एड्रेस करें, एंड आई होप, आई रियली डू, कि इन क्वेश्चन से या इस सेशन से मुतासर होकर और भी बहुत सारे लोग, या बहुत सारे वो क्वेश्चन जो लोगों ने कभी पहले पूछे नहीं है, या उनके माइंड में उस तरह का पाथ क्रॉस नहीं हुआ, अवेयरनेस बढ़े और वो सारी चीजें बाहर आए जो आज तक लोग पूछने से कतराते रहे हैं, या खवातीन पर्टिकुलरली, क्योंकि शर्म हया के मसाइल और इस टाइप की बहुत सारी चीजें ऑब्जर्व की जाती हैं इस तरह के प्रॉब्लम्स में. लेकिन वही बात है कि शर्म में शर्म नहीं होती. तो आई होप वी कैन स्प्रेड दिस लाइट for the people who really need it. Thank you very much, Anam. Thank you so much. On this note, I'm ending the session right here.